Qualitas Medical Group is in expansion mode with the aim of having 500 clinics in its network by 2022. But as private healthcare faces increasing regulation, will that curtail growth? We talked to founder and MD Dato' Dr. Nurul Amin Muhammad Ishak on what's fueling the group's expansion and how it plans to navigate compliance issues going forward. Qualitas wants to set up 200 more clinics, bringing the total number to 500 by 2022. What is driving this expansion?
I think to start off, it's starting with a big question. How do you want to drive this business? We have grown for the last 20 years into where we are today, and we are now what you call Asia-Pacific coverage, right from Malaysia up to Australia. We want to go into other ASEAN countries as well to be more Asia-focused. Okay. Now we have reached about nearly 200 to 300 clinics in the last 20 years. I think because of our reputation and we have fine-tuned the processes of mergers acquisition, we have set ourselves a target to reach 500 within 2020.
The group specifically wants to expand in Southeast Asia. Why this region specifically?
I think if you look at the demographics, I think some of the countries in Southeast Asia are growing quite rapidly. We like to go into a country where it's not only there's a growth, but the growth of the middle income group, which needs better quality of care, if the demand is there. And these are the areas I think we want to take advantage of. Yeah.
What kind of investments are we seeing?
But maybe up to 2020, we are looking at anywhere between US 150 to about 250 million.
Very recently, Qualitas announced plans to go into Vietnam. Could you tell us more about this move? What kind of prospects do you see in this country?
I think Vietnam is a country which has really come out into big players. I think the population is a very interesting thing. It's about 70 to 80 million people. And I think the growing middle class, which has got a buying power, wants more facilities, which is not provided by the public sector. So there is a big rush. A lot of private hospitals have opened up in Vietnam. And we are looking at the place we are familiar with, the primary care and ambulatory care services.
Other than Vietnam, are you eyeing any other countries?
Yes. We are keen to go into Myanmar, Bangladesh and maybe Indonesia. One particular area which has always been attractive to us is the Middle East. Certain countries in the Middle East have been approaching us. And of course, something very far was the African countries. I'm a great believer the next Asia is going to be Africa. And I think, if the time permits and if I'm still around, maybe it's my next, I will still really want to explore the African countries.
Healthcare spending, as we know, is expected to hit something like 80 billion ringgit in Malaysia by 2020s. Yeah. How will Qualitas, take advantage of this? I
think if you look at Malaysia, it's quite unique in the sense that, if you look at the GDP expenditure of Malaysia, it's about 4.7 to 4.9, but the government only spends about 2.2 or 2.3. The balance is spent by the private sector. So looking at which sector it is going to grow, I think government, there's only certain limitations that government can spend. I think most of it's coming from the private sector. We being in the private sector, I think the cost is a big issue. Not only for the premiums are going to go up, as well as even out of pocket is going to be really very expensive. So that's where we want to take advantage of the situation and provide a lot of facilities at a daycare setting, outpatient setting, at a lower cost.
Looking at the trend in your current network of clinics, right? What kind of patients do you guys get?
So I think majority of our patients are actually acute. Means episodic, we call them, when they come in with a cough and cold or a headache or a stomach ache or something, majority. But we are trying to build up the chronic care patients. That means a non-communicable disease like diabetes, hypertension, asthma and all those things. And also a big component of a preventive. That means you come to a clinic and you don't have to be ill. You come for a checkup to make sure that everything is in order, or you impending problems like you're developing early hypertension or early diabetes, you're going into any asthma. So prevention. So we have tried to build that as well.
We all know that healthcare is getting more expensive. So how does Qualitas plan to manage this?
But if you analyze it much further, we divide it into primary care, secondary care and tertiary care. Most of the expenses are in the tertiary care, in the hospital-based environment. I think what we are trying to do is a lot of things can be done at a lower setting, which can be the cost reduction. For example, managing chronic care, non-communicable diseases, doing minor procedures like the center we are in. We're able to do a lot of minor procedures which currently are done in hospitals at half the cost. So I think we want to be in the place where we go into primary and secondary care which we offer a cheaper alternative for the same procedure with the same quality. That's why we wanted to really push these ambulatory care centers and primary care centers so that people who can get these facilities at much cheaper cost in a better environment.
So understand this is the first ACC,
Yeah.
right? Are there plans to set up more ACCs?
Yes, definitely. I think we want to set up more ACCs, not only in Klang Valley, in other areas, northern and southern region where we have a primary care clinic.
Malaysia is the country where Qualitas has the most number of clinics. Will Malaysia remain your largest network?
We're still growing. We're acquiring, every other month we're acquiring clinics around it. But we are finding that, it's become challenging. We need to go by the Private Services Act, which is very difficult for us going forward.
Okay.
And also dealing with the managed care. These two issues are compressing the growth of primary care in this country. In the last 2 years, I think nearly 600 clinics have closed for various reasons. People like us, a large network of clinics like a big group practice like us, because we have got the support systems, back end of the legal systems, we have people to look at the accounts and all that. We are surviving, but our margins are compressed because of those.
What is the main challenge that GPs are facing actually?
In the Services Act, they have incorporated the fee schedule as part of the Services Act, which I think is wrong, because we are a private sector. The private sector does not receive any funding or incentive or tax breaks from the government. It's a free market.
Okay.
But that has been, the current fee schedule has been there for 13, 14 years. The base pay for the staffs have gone up. It is a minimum pay. The rentals are going up. The cost of medicine going up. The cost of doing business has gone up 3-4 times, but our revenue is the same because the last 13 years. I think we need to be fair to the patients as well. I think we cannot impose too much of cost to them. I think that the ministry has to really have a dialogue with our primary care physicians to say come up with a reasonable amount of consultation to them. And there's some monitoring factors, like clinical outcomes.
Okay.
The patient doesn't come very often. You see them for a while and then you treat them, clinical outcomes. Some kind of a data collection from the ministry to say how it's being treated. So all those things has to come into place to make them accountable for the treatment they do and then the money they charge.